Now we all understand how important breastfeeding is both for the mother and for the child. Of course, breast milk is the best food for a newborn baby, but this also puts a lot of emphasis and pressure on a new mother during this period. Now there are lots of emotional benefits for a mother during breastfeeding, the most important of which is caused by the release of a hormone called oxytocin. Now oxytocin is basically a wellness hormone. So what this normally does for a new mom, it helps in the release of milk from the mother's breast, but it also has additional effects on the mother's well-being. It induces a sense of calmness, it helps the mother bond with the baby. So breastfeeding definitely helps the mother produce this sense of calmness and bonding, which will help the breastfeeding process as well. Now what oxytocin also does is it reduces stress in the mother. Now we all know that stress causes changes in the mother's body, and high stress can lead to conditions like blood pressure, high blood pressure and diabetes in the mother in the long term, and breastfeeding definitely helps to protect against that. Now breastfeeding mothers always have a better feeling of self-esteem, so this is another beneficial effect on the mental state of a new mother. Now contrary to what we might think, we would think that breastfeeding affects a mother's sleep patterns. In fact, we would think that it makes it worse, but studies have shown that breastfeeding moms have better sleep patterns than non-breastfeeding moms. They do have deeper sleep, better quality sleep, and they are able to sleep quicker. So that's a very positive benefit of breastfeeding for mothers. Now, because of this feeling of calmness, reduced stress and good sleep, the chance of getting postnatal depression in breastfeeding moms is much lesser compared to moms who do not breastfeed. So all these positive benefits of breastfeeding on a mother's psychological status is a very important positive benefit of breastfeeding. Now what can we do to help this mother establish breastfeeding and continue breastfeeding? Because we now know that in addition to all the positive benefits for the mother, there are positive benefits to the in addition to the positive benefits to the baby, there are positive benefits to the mother as well. So what can we do to help a mother to deal with this process in a positive way? Now first of all, the solution is to start early in the mother, during the pregnancy, late pregnancy state itself, to start attending antenatal classes to help her prepare for the physical changes in her breast and for her to understand the process of breastfeeding. So antenatal classes are a very important part of this, and it's not just for the mother alone, it's also for the mother and the husband to be involved during these classes. And in addition to learning the process of breastfeeding, it also helps to identify problems in the specific mother, like flat or inverted nipples, which can be worked on during the pregnancy and definitely post-delivery. Now as soon as the baby is born, again in our hospital, and I'm sure in most major hospitals, there is a lactation consultant who actually sees the newborn and the mother, and makes sure that the latching process is as perfect as possible, because we do know that getting this wrong can lead to painful or sore nipples, which can again affect both the feeding process itself, and it can also reduce the milk supply from the mother. So it is very important for the mother, as soon as the delivery happens, to establish breastfeeding as soon as possible, because encouraging skin to skin contact with the baby definitely helps in oxytocin release, which again stimulates milk production in the mother. So establishing this as soon as possible is a very important part of the breastfeeding process. Now getting the help of a lactation consultant to identify any early problems in breastfeeding is actually very important before the mother leaves the hospital. Now, once breastfeeding is started off in the hospital and the mother is comfortable, the next step is basically to continue this process at home. Now, what can we now do for the mother to help this process to be continued? It's very important for the family members, the husband and the family, to be as encouraging as possible for this new mother. So giving her a place where she can breastfeed the baby comfortably and safely and privately is a very important thing. Providing milk or snacks and drinks to the mother also is equally important when she's breastfeeding the baby. Supporting her, especially when there are problems with breastfeeding, giving her a supporting and helpful feedback to the mother while she's breastfeeding also creates positive mental changes in the mother that helps her to continue with the process of breastfeeding. So support from the family members is a very important part of the mother continuing with the breastfeeding process, this helps the mother to continue with feeding, and this also helps her in the long term to reduce her chances of getting postnatal depression. There are some mothers who might have negative feelings of lack of confidence, feeling low, feeling depressed, but usually these symptoms only last for a few days to few weeks, and support both from the family and from our lactation consultants will help the new mother tide over this difficult period. Now, I hope all these pointers were useful for you, and I wish you a very safe and healthy and happy motherhood. Thank you.